The United States operates under a federal system where policy outcomes result from legislation, administration, and enforcement. The Democratic Party, like any major political organization, has pursued a range of policies across healthcare, education, social welfare, and environmental regulation. Observers note that while these policies often aim to address inequality, promote social justice, and expand public services, internal contradictions, ideological factionalism, and inconsistent implementation have sometimes hindered their effectiveness. This documentary examines these dynamics, the observable patterns of the internal conflict, policy inefficiency, and self-defeating outcomes within the liberal politics. Healthcare and social programs. Expansions of Medicaid under the Democratic-led initiatives increased coverage for low-income populations. However, implementation varied across states, producing gaps in access. Critics cite delays in enrollment systems, conflicting eligibility rules, and administrative bottlenecks. Some analysts argue that these inconsistencies were exacerbated by the internal disputes over the policy priorities, where progressive and moderate factions disagreed on design and funding mechanisms. The Affordable Care Act, a landmark Democratic initiative, illustrates this pattern. While millions gained coverage, state-level disagreements and legislative compromises diluted certain provisions, slowing the intended outcomes. Internal policy conflict can produce outcomes that deviate from the original goals, creating inefficiencies that affect public trust. Education and local policy conflicts. Education policy provides another example of the intra-party disagreement. Federal and state programs aim to standardize funding and curriculum initiatives, yet implementation often varies due to the ideological divides within the party. For example, debates over curriculum content, standardizing testing, and funding priorities have caused legislative delays. Some districts implemented progressive policies aggressively, while others retained traditional approaches, leading to inconsistent educational outcomes. Public discourse frequently reflects these conflicts. Activist groups and party members have sometimes clashed publicly, criticizing colleagues for perceived compromises or deviations from the ideological purity. Analysts observe that this factionalism can slow policymaking, reduce transparency, and generate confusion among stakeholders. Environmental regulation and policy reversals. Democratic administrations at federal and state levels have pursued environmental regulations targeting emissions, industrial activity, and energy production. While measurable reductions in certain pollutants are documented, internal disagreements about implementation, economic impact, and enforcement schedules have delayed some policies. For example, proposals to expand clean energy initiatives were revised multiple times to accommodate competing interests within the party, slowing adoption. Critics argue that the prioritizing ideological and symbolic goals over practical feasibility can result in policies that underperform or encounter resistance from industry and local governments. Proponents emphasize long-term environmental benefits, highlighting the trade-offs inherent in policymaking. The internal party conflict and factionalism. Internal conflicts are not limited to policy implementation. Voting records, public statements, and primary election challenges demonstrate recurring factional disputes within the Democratic Party. Progressive versus moderate factions often disagree on the pace and scope of reforms. Leadership disagreements have produced public criticism, legislative delays, and inconsistent messaging. These dynamics have been described by political analysts as patterns where parties eat their own tail, prioritizing ideological purity over the coordinated strategy. The result can be internal discord, mixed messaging, and reduced policy effectiveness. Case studies include disputes over healthcare funding formulas, federal relief allocation, and climate legislation, In each documented disagreements delayed implementation or forced compromises that altered original objectives. Public perception and media influence. Surveys conducted by the Pew Research Center indicate that Americans perceive partisanship and internal conflict as significant factors affecting policy effectiveness. 62% of respondents supported environmental regulations, but 48% worried about economic cost. Public debates over healthcare and education reforms often emphasize conflict within the Democratic Party rather than the cross-party compromise. Media coverage amplifies these perceptions, focusing on controversies, disagreements, and reversals. Analysts argue that this can reinforce the narrative of the inefficiency and the instability regardless of the policy outcomes. Policy outcomes and real-world effects. Healthcare expansions increased coverage, but unevenly. Education funding improved some districts, but delayed reforms in others. Environmental regulations reduced certain pollutants while encountering implementation challenges. Analytical interpretation. The analytical interpretation is these outcomes demonstrate that internal conflict and policy complexity can hinder effective governance. Even when objectives are clearly defined, these are observable, documented patterns, not personal attacks. In conclusion, the Democratic Party, like any political organization, operates in a complex system with competing priorities, ideological divisions, and administrative constraints. Internal conflicts, factionalism, and policy missteps are documented phenomena that affect governance and public perception. This documentary provides a fact-based examination of these dynamics using legislative records, federal data, and peer-reviewed studies to illustrate how internal behavior, decision-making, and strategic choices shape policy outcomes. Across multiple states and federal offices, policy decisions by various leaders have faced significant public scrutiny. Governors, members of Congress, and other elected officials, including those in Washington, Minnesota, California, and elsewhere. When you have people like Katie Wilson, or a Tim Walz, or a Gavin Newsom, or a Jay Inslee, or a Bob Ferguson, or a Amy Klobuchar, it goes on and on. These are awful people with donors in mind, and they don't care about human lives, nor do they care about anybody in their cities or states. People need to understand you will never move forward without getting rid of the trash. So when you have these kind of things happen in Washington, Minnesota, Oregon, California, New York, you can see why things have gotten so bad. They have implemented programs and made legislative choices that critics argue have contributed to the inefficiencies, mismanagement, and unintended consequences. So the examples include disputes over public funding allocation, responses to social welfare programs, environmental regulations, and oversight of federal relief funds. Analysts note that inconsistencies in implementation, partisan gridlock, and conflicting priorities can slow progress and create challenges for effective governance, but these people do not care. Until these systematic issues, including lack of coordination, accountability gaps, and poorly enforced oversight, are addressed, critics argue that meaningful reform will remain difficult. The focus, therefore, is not on individuals personally, but the leaders in these states. They are the ones causing the problems. These lobbyists and these donors are feeding these demons into being the way that they are.